And so we are here once again with Ms. Sylvia Lemus, who is again a representative of the county of Sonoma. I actually have never asked you what is your title, Ms. Lemus. I just say Ms. Sylvia Lemus.
Yes, I'm a public information officer for the County of
Okay,
Sonoma. I
good.
work in communications.
Thank you. And so tell us what's going on. People decided not to stay home for Christmas, for those who celebrate that holiday. People decided not to stay home for Thanksgiving. People decided to go out for New Year's. What are the consequences? We knew something bad was going to happen. What are the numbers like?
Yes, Rafael, the numbers are still not good. They continue to get worse. We now have a total of 20,501 cases confirmed, which in the last 24 hours is 354 additional cases. So that's what I've been seeing, a trend of 200 cases, 300 cases. And every day, if you look, there's information on our County Sonoma dashboard that has it. You could look at it by date. Um, Unfortunately, we have a total of 213 deaths, and that includes 9 deaths in the last 24 hours. Day before yesterday, there was 8 deaths. So unfortunately, again, we're losing people to COVID because the numbers aren't getting better and people are getting sick. And some of them are getting to the point where they just can't don't survive. And we are doing a lot of testing, but the numbers are not doing good. Our ICU numbers here locally, I think, are okay still, but our regional, which is the Bay Area region, is at 7.4%. I remember it needs to be 15% to avoid the stay-at-home order. So our guess is that we're going to continue with the stay-at-home order past tomorrow. When we had said at first the 9th is going to be the last day, but I think that it's going to be extended. We just are waiting for word from the state.
Definitely, with the numbers that we're seeing, this is
Mhm.
completely unacceptable. As you said, it was, I think, 9 yesterday, and then it was 8,
The
or in
day
the last
before.
24 hours, then 8, then
Mhm.
2, then 6. I'm just going from memory, but those are horrible numbers and we feel for the people who have lost family members,
Yes.
especially if they had no say in getting sick, which is where I always bring the conversation to the level of negligence. Back in March, in April, maybe, we could say people are getting sick because they're not being provided with the tools, including the knowledge of washing your hands, this and that.
Mhm.
But almost a year later, we know so much about this virus that a lot of people, it appears, and based on the responses and the research and the reports, that a lot of people are getting sick out of negligence.
Mhm.
Please stay home. So they go out and do exactly the opposite, right?
Mhm.
And so at what point, if we continue in this direction, are we going to get to the level of LA where ambulances get the call and they just show up and they get to determine? These are people who have like a year of training at most,
Mhm.
and they now get to determine who lives and who dies. And how bad is it going to get in Sonoma County?
And it shouldn't be that way. Our ambulance drivers, our ambulance staff should not be deciding life or death here in Sonoma County. Like I said, right now, we have high numbers, and they're not really going down. We have a little bit of ICU capacity. Um, Regionally, we're at 7.4%, and I just feel like we need to do everything we can to stop the spread. And like I said, people are not really complying with the order. We see people they're tired of the pandemic. They're forgetting about the basics. The basics: wear your mask, wash your hands, stay 6 feet. Stay away from people that aren't part of your household. All those different things. I mean, even shopping. I really try to be more selective about where I shop. I go to Oliver's a lot. I live near an Oliver's too, but I like that they are in Trader Joe's. They're very careful about shoppers, and I feel more protected when I'm shopping in the stores. So I just feel that we have to kind of be aware all the time of everything we're doing and what everyone else is doing around us. And, because we have to take care of each other and especially take care of us so that we can continue on.
Yeah. Yeah, and again, people need to take care of themselves. People need to get tested. What can
Mhm.
you tell us? It seems like the county now has a different type of test than we used to have. I know a lot of people were reluctant because they felt that the test that went up your nose was
Mhm.
very uncomfortable to deal with it.
Yeah.
So some people chose not to take the test. What are the changes that came up?
Yes, I can bring more information on it, but I know that they're not really using the swab anymore. They're doing the mouth swabbing now. So they're going and getting the specimen from the mouth. And so that's something new. And I think it had to do a lot with where we changed. We partner now with Curative, which is an agency that's doing a lot of the testing for us. We still have OptumServe, which is state run. We have Project Baseline, but Curative is doing a lot of our county testing now, and they're doing the mouth swab versus the other nose swab. But in addition to that, we're continuing to do the pop-up testing in targeted neighborhoods. So we're continuing to do a lot of testing. And so, like I said, I don't have all the details on the mouth swab versus a nose swab, but I know that they have been changing over to that.
And that brings us, right? People need to go get tested. And again, as I've always said, if your boss at your job today tells you, you know what, we just found out that so and so, your coworker who was here yesterday just tested positive for COVID, people need to go get tested as soon as possible. People need to call the number that hopefully you'll give us in a second, because I can never remember it, on how to schedule a test. And at the same time, if because it's immediate, people should just go, and if there's a test in place, they should just go and ask to be tested and let them know that their supervisor just let them know that they were at risk of getting COVID. And I want to clarify, next week I'll be covering some of the many new laws in California, but one of the ones that just happened is the one that says that now an employer has only 24 hours to tell their employees if somebody at work tested positive for COVID or if they were potentially exposed to COVID. So can you tell us how to get tested? What's the phone number where people can reach it?
Yes. So first of all, we ask people to, if you have a healthcare provider, to first go with your healthcare provider to schedule tests, because that's probably the fastest way, hopefully. But because we have so many different testing providers, the dates and the timeframes kind of change. But if you go to our website, SoCo Emergency, you can make appointments for a lot of the different testing, like Curative, OptumServe. There's links to all there. In addition, so then if you don't have access to a computer or you want to call, make an appointment, you can also call and you can get help from the county hotline for testing. The number is 707-565-4667. And they can help you to schedule an appointment with Curative or one of the other sites. And we're also continuing to do, the county is doing the pop-up sites in the neighborhoods, in targeted neighborhoods. So for those, like if you really feel like you need to have a test, even though they do have scheduled testing, they do have some tests that are available, like first come, first serve. So we know that people go there before they even start their testing time, so they can make sure they can get a test. So that's a fast way of also getting your results back. So for example, today's Thursday, tomorrow Friday, Burton Avenue at the Burton Recreation Center, Curative is having testing there. But I think for that one, you do need to have an appointment. I'm sorry, there was Andy's Park. Yes, Andy's Park is also tomorrow, Friday, starting next week. It's scheduled to begin next week, the 15th. But at Andy's Unity Park, you can start, you can go there for testing starting next Friday. But then, and they'll change around. But if you go online, there's a calendar. It'll show you all the locations.
So again, SocoEmergency.org, that's also where you can find the latest numbers on the number of people who tested positive. And unfortunately, also the number of people who passed away in the last 24 hours. And then the last piece I would like to talk with you today, and I apologize, I cannot give you additional time today because I have another appointment at 5:30, but for next week, I'll make sure to schedule more time for this dialogue. It's so essential. But can you tell us about the actual vaccine? What is happening? Yes. We celebrated that a few thousand had arrived a couple of weeks ago when we last saw you. What can you tell us?
Yeah, they started with our first shipments arrived December 17th. Now to date, we've received 17,575 doses of Pfizer and Moderna. And so we've so far vaccinated up to 8,046 residents have been vaccinated according to the tiers. We have our website that we're really using, socoemergency.org, and in Spanish too, where we're putting a lot of information about the phases and the tiers, because the people will be tested according to those phases and tiers. And so the county is doing some testing. The Walgreens and CVS is doing testing of skilled nursing facilities and elder residential care homes, residential homes. And Safeway is going to start helping us with some of the testing of community health workers, promotoras. So we'll be working with community partners as well as the county, and the hospitals also receive their own vaccines, and they're offering vaccines to their staff and personnel as well. So we're slowly kind of moving through the phases. It's going to be a while, but the general population maybe won't be until a few months down the road, maybe April, May. We're just not sure because it depends, and the different agencies are going at different speeds. Like for example, Kaiser said they were ready to move on to a different phase. And so it really depends on the personnel they have to administer the test, because we can have all these doses. You probably have heard that we may not have enough people. And right now we're looking at volunteers. We're working with the State Medical Reserve Corps to identify volunteers that can help us administer the test. But so far we're doing okay as far as our administration of the vaccine. And we're trying to build up our resources so that we can administer them as the doses come in. Yeah, so, and soon we'll be pushing out more information about more dates and how to kind of, because people are asking us, how do I get in line? How do I get a test? And we're working on that communication, and right now the only thing that we have to offer is our SoCo emergency website, that if you go there, you'll see there's a lot of information with good graphs and everything that show some estimated timelines of when different sectors and groups will receive the vaccine.
Good. And again, I look forward to our conversation next week. And I hope that by then, again, we can have a little bit of a better idea, an update more than anything on the number of vaccines that have arrived, how many have been given out, and maybe which of the many phases we're looking at, because we know that the other reality is those will change likely how quickly once the AstraZeneca vaccine gets approved or not approved in the United States, and the Johnson & Johnson vaccine, which is still in trials and is not going to go in the United States, I think, for request of emergency approval until late January, if I remember correctly. And so I look forward to our next conversation, and thank you, and Happy New Year to you.
You too, Rafael. Thank you so much.
Take care.